Hello again, students. Welcome to this new topic about the lymphatic system. In this topic, you will learn how the lymphatic system is functionally related to the cardiovascular system and to the body's immune defenses, which I will discuss in the next lecture. The main function of the lymphatic system is that it carries excess interstitial fluid from the tissues back to the cardiovascular circulation. Also, one important function of the components of the lymphatic system is that it serves as the training or battlefields of various immune cells. The lymphatic system consists of two parts, the lymphatic vessels and the lymphoid tissues and organs. Even if blood circulates around the body, nutrients, wastes, and gases are exchanged between blood and the interstitial fluid. Normally, about 3 liters of fluid remain in the tissue spaces daily. This significant amount of fluid must be carried back to the vascular circulation to maintain the body's blood volume within normal levels. These fluids are transported by the lymphatic vessels back to the cardiovascular system. Meanwhile, the lymphoid tissues and organs house the phagocytic cells and lymphocytes that are needed for the body's immune response. Let me talk about the lymphatic vessels more in detail in the next slides. The lymphatic vessels, also called lymphatics, is a unidirectional drainage system which carries excess interstitial fluid called lymph back to the blood circulation. The lymph capillaries, which are part of the lymphatic vessels, weave between the tissue cells and blood capillaries in the loose connective tissues of the body. These capillaries function as a sponge by absorbing effectively leaked fluid. Although similar to blood capillaries, lymphatic capillaries are so remarkably permeable that they were once thought to be open at one end like a straw. However, the edges of the endothelial cells forming their walls loosely overlap, forming mini valves that act as one-way swinging doors. Lymph is transported from the lymph capillaries through successively larger lymphatic vessels, referred to as lymphatic collecting vessels. Then, lymph is finally returned to the venous system through two large ducts in the thoracic region. The right lymphatic duct drains lymph from the right arm and the right side of the head and the thorax. The large thoracic duct receives lymph from the rest of the body. Now, let me move on to the next major component of the lymphatic system, which are the lymphatic tissues. The lymph nodes are one of the major groups of lymphoid tissues that have important functions in the body's immune response. The lymph nodes contain cells that help protect the body by removing foreign material from the lymphatic stream. This is the reason why, when we have an active infection, say an active infection of our upper respiratory tract, our upper neck will have some palpable swollen areas. These are actually our lymph nodes trapping and fighting off the infectious agent. Within the lymph nodes are macrophages, which engulf and destroy bacteria, viruses, and other foreign substances in the lymph before it is returned to the blood. Also, collections of lymphocytes that function in the immune response are located in the lymph nodes. In this slide, I will talk about the structure of a lymph node. The outer part of the node, which is called the cortex, contains collections of lymphocytes called follicles, many of which have dark staining centers called germinal centers. Phagocytic macrophages are found in the medulla. Lymph enters the convex side of a lymph node through the afferent lymphatic vessels and exits from the node via the efferent lymphatic vessels. This illustration shows the distribution of the lymphatic vessels and lymph nodes in our body. Particularly large clusters of lymph nodes are found in the inguinal, axillary, and cervical regions of the body. The next lymphoid organ is the spleen. The spleen is a soft organ located on the left side of the abdominal cavity, just beneath the diaphragm, that curls around the anterolateral aspect of the stomach. Instead of filtering lymph, the spleen filters and cleanses blood of bacteria, viruses, and other debris. Furthermore, the spleen provides a site for lymphocyte proliferation and immune surveillance, but its most important function is to destroy worn out red blood cells and return some of their breakdown products to the liver. Lastly, the spleen sequesters platelets and acts as a blood reservoir. Another lymphoid tissue is the thymus. Similar to the spleen, the thymus also does not filter lymph. The thymus is a lymphoid mass found in the anterior mediastinum overlying the heart. The hormone thymosin, among several others, is produced by the thymus. Thymosin functions in the programming of the T lymphocytes. The tonsils are small masses of lymphoid tissue deep to the mucosa surrounding the pharynx or the throat. Their job is to trap and remove bacteria or other foreign pathogens entering the throat. They carry out this function so efficiently that sometimes they become congested with bacteria and become red, swollen, and sore, a condition called tonsillitis. The Peyer's patches and the appendix are also part of the lymphoid tissues. These organs contain macrophages that destroy harmful bacteria. Together with the tonsils, the Peyer's patches and the appendix are part of the collection of small lymphoid tissues called MALT or mucosa associated lymphoid tissue. MALT acts to protect the upper respiratory tract and digestive tract from foreign materials entering those cavities. This illustrates the summary of the different lymphoid organs. You can see the different locations of the lymphoid tissues, including the tonsils, thymus, spleen, Peyer's patches, and appendix. This is the end of my discussion about the lymphatic vessels and lymphatic tissues. Thank you for listening.